Okay, so for question 7, we have potassium chloride elixir, 40 milliequivalents by mouth 4 times a day with juice. And then what's available is potassium chloride 20 milliequivalents per 15 ml. And then we want to mark the cup and also determine the correct milliliters. Now, you can do this question or answer this question in 2 different ways. I'll write out the dimensional analysis just so you can see it in case you're wondering, do I write something? Do I need to write something? Or, or do I not need to write something? Because some of you may have just said, okay, well, if it's 20 per or 15 milliliters per 20 milliequivalents, I orders 40, then my answer is 30, and you did it right. You got the right answer. But since they're going to ask you to write your question, what you're going to do is, again, this is number 7. You can take your order and then multiply it by your conversion, which is 20 per 15. And then that's how you get 30 milliliters. Now, this question gets missed often, and the main reason it gets missed often is not because of the math, it's because you didn't mark the cup. So make sure you mark the cup. Number 16. All right, so 16 is a drop factor question. Remember with the drop factor, you need to know 3 pieces of information. You need to know the flow rate, volume over time. You need to know the drop factor, which will be given to you. And then just make sure your time is in minutes, and then you'll be all set. So for 16, as I mentioned before, you need to know flow rate. You need to know drop factor. And those 2 pieces of information will give us the drop rate. So what's my flow rate? It says 75 milliliters, and it says in 25 minutes. Drop factor is 15, because that's what it says on the label. 75 times 15 divided by 25, and you will get 45 drops per minute. (17) is going to follow the same methodology. So I'm just going to change markers here. 17 is another drop rate question. It says your patient is to receive, I always just like to kind of show the thing here. So your patient is to receive Solumedrol 200 milligrams IV. It is received from the pharmacy in a 75 milliliter bag of dextrose 5% water to infuse over 30 minutes. Drop factor is 10. No other IVs running. What is the drops per minute? So there's extra information in here. Okay. Remember, I told you need 2 pieces of information in order to calculate drop rate. You need the flow rate and you need the drop factor. This tells you patients to receive Solumedrol 200 milligrams IV. That's great. But in order to calculate the rate, that's the question. So the way that we're administering that, they're going to get this 200 milligrams IV, assuming that they're going to get it based off of the rate that we're calculating. So 75 milliliters, 30 minutes times 10. Which will give us 25 drops per minute. So 75 times 10 divided by 30 is 25 drops per minute. So again, with these questions, just keep in mind, so there might be extra stuff. You just care about the flow rate and you care about the drop factor. The example I always use is, like, let's say you're on your way to, you're going to the Jersey Shore to do some vacationing. You're going to Myrtle Beach. You're traveling 60 miles per hour. You know, you really only care about how long it's going to take you to get there when it comes to rate. When if that asks how long it's going to take you, it doesn't matter that you're driving a minivan or a sports coupe. It doesn't really matter what you're driving, just depends on the rate. So keep that in mind. 22 and 24. So 22 and 24, well, I'll say 22 and 23 are warm-up questions for the Heparin protocol. And then, so 22 will be an example of that. So let's go ahead and do 22. So 22 says that the order is the 0.4% normal saline, 1,000 milliliter IV with heparin, 25,000 units to infuse at 1,000 units per hour. What is the flow rate in milliliters per hour? So for these questions, I always start off with what is the rate they give you? So it's 1,000 units per hour. We don't want units per hour, we want milliliters per hour. So I need a way to convert units to milliliters. And thankfully, I have an IV bag to help me do that, because the IV bag contains units and contains milliliters, specifically 25,000 units and 1,000 milliliters. And again, I'm pulling that information right from the question where it says we have 0.45% normal saline, 1,000 milliliters with heparin, 25,000 units. So they're both in the same bag, same IV bag. Then I don't have this memorized to tell you the answer. You're going to do 1,000 times 1,000 divided by 25,000. And you will get 40 milliliters per hour. And then those of you who get hung up on my usage of dimensional analysis, again, I mainly just do this so I can see what I'm canceling out. And then before I do any math, I already know I'm in milliliters per hour. Okay, that's why I choose to use it, or at least to show you guys. When I'm doing this stuff in my head, obviously there's nothing to show you, just answer it. All right, 24. Same type of question, still talking about flow rate, but this time we want to know not only how long it'll run for, but what time of the day it will stop running. Okay, so I have 1,000 milliliters that's infusing at 50 milliliters per hour. And I want to know when, if the IV starts at 8 a.m. on Monday, what day and time will it be when it finishes? So a couple of ways to do this. I'm just going to show you the way that makes sense to me. Again, I use dimensional analysis because when the question is convert milliliters to hours, do I have a way to do that? I do, because I have my flow rate that I can just flip over 50 milliliters per hour. 1,000 goes into 50, 20 times. So our pump is, or our bag, our 1 liter bag is going to be infusing over a period of 20 hours. So we start Monday, 8 a.m. 20 hours later, what time is it going to be? Okay, so this is one thing that I do. I say, okay, well, what would it be in 24 hours? 24 hours will be Tuesday, 8 a.m. Okay, so in 24 hours, it'll be Tuesday, 8 a.m., but it said 20 hours. So I'm just going to subtract 4 to give me 4 a.m. on Tuesday. Tuesday at 4 a.m. is when the infusion will end. All right, so the Heparin protocol I've written out or I've done a couple of times. It is on YouTube already. But we can go through this. And then what I'm going to do is I'm going to make things interesting. I'm actually going to go through this. And what I'm going to do, I'm actually going to use a different weight. Okay, so we're going to try this with a different weight and see what we get. This will be, like I said, a variation. And really, that's the only thing I can change on this particular question is the patient's weight. Everything else is it's the protocol. The protocol has 15 steps, and you just follow what it says in the protocol, and it's this protocol. So like you do a Google search for Heparin protocol, this is what will show up. You don't need to worry about the CBC. You don't need to worry about the Gaiaic stool. You don't need to worry about when to schedule the neurochecks. All that stuff would be filled in. We just care about the math for the Heparin protocol. So what I'm going to do is I'm going to do the Heparin protocol, but I'm going to do this for a patient weighing 176 pounds. Okay. So it'll be a different variation. And then again, this will be available on Blackboard for you guys. So before we get started, the protocol states that you're going to bolus the patient with heparin 80 units per kilogram body weight and start a drip at 18 units per kilogram per hour. That information is restated in step 10 of the protocol. So the first step is we want to convert the patient's weight in pounds to kilograms. Okay, so you don't need to write that in here, but you need it in order to answer the questions that are down below, which is milliliters for the bolus and the flow rate for the IV drip. Okay. The other thing that's important is step 2 of the protocol is where it tells us what our availables are. So we have an IV of 25,000 units within, or that's contained in 250 milliliters, half normal saline. And our bolus dose is sitting out at 1,000 units per milliliter. So these are two different strengths. This one, the bolus dosage strength, is used for the bolus calculations. And then the 25,000 units in 250 ml is used for the flow rate questions. So let's get started. Okay, so I said the patient's weight is 176 pounds. Keep in mind, this will change our answer. That's listed in the back of the packet because we're doing a different weight. So 176 pounds. I want to convert that to kilograms. And I'm just going to type that into my calculator. I'm going to take 176 divided by 2.2, and I get 80 kilograms. Okay. So the patient weighs 80 kilograms. Now, in order to solve part A, it tells me a couple pieces of information. It says to calculate the bolus dosage strength in milliliters for starting this patient on the Heparin protocol. So we're going to take the patient's weight, which is 80, and we're going to multiply by the initial bolus dosage, the initial bolus order, which is 80 units per kilogram. When I do that, that eliminates kilograms, and we're going to be left in units. So 80 times 80 is 6,400 units. Now, again, I don't want units. I want milliliters. So I'm going to go back to the protocol. And in step 2 of the protocol, it tells me bolus dosage strength is 1,000 units per milliliter. So I'm going to multiply that by that conversion. I don't want units. I do want milliliters. 1,000 units per milliliter. 6,400 divided by 1,000 is 6.4 milliliters, which would be your bolus dose for a patient weighing 176 pounds. I will add that if you do this and it's like, let's say it's 178 pounds and that changes your kilograms where you have a decimal, round to the nearest tenth. and that will, you can do that right off the bat. So first, step one, always with the heparin protocol, step one is to convert the patient's weight in pounds to kilograms, and then round kilograms to the nearest tenth if rounding is required. Okay, part B says to start them on an IV drip, 18 units per kilogram per hour. So same patient weight, but now we're going to multiply by 18 units. This time it's kilogram hour. So this is our flow rate question. 80 times 18 is 1440. And that's units per hour. Excuse me. Again, I don't want units per hour because it tells me to calculate the milliliters per hour. So I need to find a way to convert units to milliliters. Again, this is where we go to step 2 of the protocol. And it tells us that we have available 25,000 units in 250 milliliters of half normal saline. So that's where those numbers come from. When I do that math, I'm going to do 1440 times 250 divided by 25,000, and I'm going to get 14.4 milliliters per hour. I'm just going to double check my math because I was doing that. So times 250 divided by 14.4 milliliters per hour. And I would leave it at 14.4. I wouldn't round this just to 14. I would round it to or keep it towards the nearest tenth following your rounding rules. The only time you'd want a whole number, at least again at CCAC Allegheny, is if we're dealing with drops, but this is not a drop. So potentially you could program that into your infusion pump. Maybe that is not the case, but we're just going to pretend that it is the case. Okay. So then after 6 hours, we retest the patient and we notice that they have an update in their APTT, and the APTT is 43 seconds. So what we're going to do is we're going to look in our table and we're going to see that step 12 of the protocol indicates an APTT of 43 seconds, and then it tells us some new information of what to do with this patient. Excuse me. Tells us to rebolus with 40 units and then to increase the rate by 2 units per kilogram per hour. So let's do what it says. So we're going to C1 is going to be calculating the new bolus dosage strength using the same patient. But this time, instead of 80 units per kilogram, it's 40 units per kilogram. And that'll give us 3,200 units. Again, we don't want units, we want milliliters. So I'm going to multiply by my same bolus dosage strength, the 1,000 units per milliliter. It's what we will use for all bolus type questions. So I don't want you to think I'm just making this up. I got it from step 2 of the protocol. And if you're paying attention here, you'll see that 80 is half of 40. So half of 6.4 would be the 3.2. And that would work out just fine for this particular question. Excuse me. C2 says to calculate the new infusion rate. Okay. So the new infusion rate, first of all, same patient, same weight. For the infusion rate, it tells us that the initial infusion rate was 18 units per kilogram per hour. After we check the APTT, step 12 says to increase that by 2. So that means 18 plus 2 would be 20 units kilogram hour. 80 times 20 is 1,600. units per hour. Again, we don't want units per hour, we want milliliters per hour. So I'm going to use my IV to convert my 250 milliliter half normal saline that has the 25,000 units of heparin in it. And then I'm going to get 16 milliliters per hour. On your test, you're going to get either A and B, or you're going to get C1 and C2. So you'll get one bolus, one flow rate question for the Heparin protocol. On the practice test, I gave you two just because I thought it would be a good idea just to give you two examples. Just to kind of give you two practice things. If you miss this question, let's say you miss A and B, you only missed one question, but you're going to practice this and you're not going to miss this at all. The only thing I can change again is patient's weight and then what the APTT is. Okay. So the APT. So if it were 80 seconds, then you would just follow what it says there. So if it said to calculate the new bolus, you would say no bolus required, right? Because if the only thing it says to do is to decrease the rate, then you wouldn't need to calculate that initial bolus. I mean, the follow-up bolus, because it wouldn't be required. So just something to keep in mind.